It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are changing lives. Let's go ahead and get started with interventional cardiologist, Dr. Annie Varghese.
I came to see Dr. Varghese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varghese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time. Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me. Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Don't skip breakfast. Fiber in the morning means less hunger in the afternoon when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically two groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
Are you aware that you can log on to our website, bestdocsnetwork.com, and request an appointment with any of the great doctors that you've seen today on the show? Like our next doctor, ear, nose, and throat specialist, Dr. C.T. Nguyen.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
Welcome. Today we have with us Dr. James Willerson, who's the President and Medical Director of the Texas Heart Institute. Dr. Willerson, we're so thankful that you're with us today. Welcome to our program.
Thank you.
We know that you've had a long history here in Texas with regard to the advancement of cardiovascular services. Would you tell us a little bit about the Texas Heart Institute?
The Texas Heart Institute was founded in 1962 by Dr. Denton Cooley as a research and education entity. And I think he dreamed that it would train many doctors who wanted to be heart doctors, cardiologists, surgeons, electrophysiologists, pathologists, so on. But that it would also do research, which would be important in preventing cardiovascular disease and making it easier for people to tolerate it when they already had it. And that's the way it's worked out over the last 50 plus years. It's ranked number 6th in the United States. It's been ranked in the top 10 for each of the last 22 years consecutively. There is no other heart center in Texas for which that same thing has been true. And we have educated thousands of doctors in all areas of cardiovascular disease.
I know that your great passion is teaching, and I've been able to sit at your feet and actually learn from the master, and I just thank you for that.
Thank you.
In front of the world, you are an amazing teacher.
Thank you.
And I know that you have taught many, probably thousands of students in internal medicine as well as cardiology. We want to thank you for that, and what would you tell the world about those who have that love for cardiovascular medicine and to study medicine? What would you tell those students?
Well, it is a passion, but it's based on the reflection that heart and vascular disease are the #1 killers of men, women, and children, not only in the United States, but in the world. Cancer's a distant second. For instance, as a woman, you're more likely to die of heart and vascular disease than you are of all cancers combined. And as a woman, you're 5 times more likely to die of a heart attack than you are of breast cancer. And as a man, 1 out of 2.5 men worldwide will have some form of heart and vascular disease during their lives. A person dies in the United States every 26 seconds, 24/7, of heart and vascular disease.
So we want to let students know around the world to continue reaching for their passion of saving lives. And we thank you for being a leader in that, Dr. Willerson.
Thank you very much. You're very kind.
You are a tremendous, tremendous person. I just thank you from the bottom of my heart.
Thank you.
I am an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong
because I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer. One simple test, and you could save your life or someone you love.
Get screened.
Be a part of 1 million strong.
I had the four front teeth were very crooked. 2 were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me. So I did some research. I don't know if there's cosmetic dentists up there. I'm sure there are, but I just didn't investigate it. But I did investigate this one, and thought, well, this looks like a good as any. And so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio. So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps in the process because I live so far away. But she's very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, oh, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family, my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, it may also boost your immune system. So bring some humor into your life.
There are 4 kinds of hepatitis. Hepatitis is a disease of the liver. This is where your liver gets inflamed and swollen. And the liver is very important in metabolizing certain drugs, and it needs to work right. Hepatitis makes it not work right for a long period of time. There's hepatitis A. This is the hepatitis germ you get from bad food, for example, shellfish, bad sewage situations, for example, in third world countries. There is a shot to prevent that. And that's a great shot to get, especially if you eat out a lot at restaurants where you don't know whether the cooks are washing their hands or not, or if you travel a lot, especially to third world countries. Hepatitis B, this is the hepatitis you get from bodily fluids, for example, transfusions of blood or having sex, that kind of thing, where you transmit bodily fluids. There is a vaccine for that too. It's a 3-dose vaccine. Most kids get this as they go through their young years, but you can get this as an adult if you didn't have it as a child. And then there's hepatitis C. That's what you get from all the other things. For example, certain foods maybe, certain bodily fluids maybe, and many causes of hepatitis C are unknown. There's no vaccine for that. And then there are the other hepatitis that can come from drugs and alcohol. And those are certainly things that you can control.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
To see more amazing videos on all of the great doctors you've seen on today's show, head to our website, bestdocsnetwork.com. Let's go ahead and check out plastic surgeon Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get, what would you say, a pouch and scar tissue buildup. So, I want to look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. I feel sexy. I can wear a bikini, where I couldn't do that since 4 children ago. So, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, I wanted to get back to me. I got my sexy back.
In today's Ask the Doctor, Mark from the Woodlands has a question for Dr. Annie. Why do I need to take so many medicines for high blood pressure?
Blood pressure is regulated by multiple receptors on a cell. So if you can visualize a cell having 20 different receptors, you can realize why one medication may affect one receptor but not the others. Therefore, it's better to have multiple medications affecting many of the receptors rather than going high dose on any one medication, because high dose usually can cause side effects. So therefore, the answer to your question is multiple medications are necessary to affect multiple receptors on cardiac cells as well as vascular cells to help regulate blood pressure. Very important to take care of that blood pressure. Keep it low, protect your heart, protect your vessels, protect your life.
For more information on the great doctors that you've seen on today's show, head to our website, bestdocsnetwork.com. Up next, we have oral surgeon Dr. Paul Metz.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable, and so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or cup of coffee at fighting fatigue.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Your doctor may want you to have a stress test. This is to check on your heart, to see how it's doing when your heart is under stress. For example, you run on a treadmill that gradually raises an incline, and that puts you into a hyperactive mode so that your heart's beating fast, and that makes your blood flow in your heart need to be optimum. Now, if your blood flow in your heart is not good, you're having blockages with plaque, then that will show up on your EKG while you're running on that upward slope and getting your pulse rate up. There are different kinds of stress tests. There's just a plain old stress test where you run. This is for those people that have injuries or can't run on an upward incline on a stress test machine.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They said, well, you know, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly. And we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well, went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
That's going to wrap up today's show. For more information on any of the great doctors that you've seen, head to our website, bestdocsnetwork.com. And if you have questions or comments, we love hearing from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.